Welcome to Optimal Outcome Precepting. This is the first session of a series of 5. This first session is on Introduction to Experiential Learning in Pharmacy and Basketball. You might be wondering what the link is between pharmacy and basketball. The idea is that experiential learning in pharmacy needs to enable the student to move from knowledge to action, to be able to convert what they've learned into performance. It's not unlike what's accomplished by basketball players in being guided by their coach. They have a knowledge of the game, but they need to be able to execute that knowledge and perform adequately in the game. So pharmacy preceptors can learn from basketball coaches and how basketball coaches enable their players to perform better in order to enhance the learning of the students on a rotation. Before I begin, let me introduce myself. I'm Dr. Daniel Brown. I'm a professor of pharmacy practice at Palm Beach Atlantic University in West Palm Beach, Florida. West Palm Beach is located on the southeast part of the United States, southern part of the state of Florida. And as you can see, the university is located right on the water. The School of Pharmacy started in 2001 at Palm Beach Atlantic University. You can see the school building on the slide there. It's a Christian university, and so all the faculty in the School of Pharmacy are Christian. It's one of about 5 or 6 Christian universities that have schools of pharmacy in the United States. My background in experiential learning will help you understand a little bit about my perspectives. I've been doing this for 34 years. I started as a clerkship preceptor, precepting internal medicine, pharmacokinetics, and drug information students at the Medical College of Ohio Hospital from 1982 to 1987. I became a hospital pharmacy director from 1988 until 2000, but I continued to precept students in pharmacokinetic rotations. That was at 2 different hospitals in California. I was the founding director of a pharmacy residency program at the Medical College of Ohio Hospital in 1986. Now, in the United States, pharmacy residencies provide the primary opportunity for students to obtain postgraduate training. We don't really have very many students complete clinical master's programs. Students who, upon graduation, want to pursue a career in academia or some type of advanced clinical practice, once they receive their Pharm.D, will complete either a 1 or a 2-year residency. The second residency program that I founded was at San Joaquin General Hospital in 1999. The principles of designing a residency training experience are very similar to the principles that are used to develop an advanced practice experience for pharmacy students before they graduate. I became the founding director of experiential education for Palm Beach Atlantic University in 2001 when the school first opened, and served in the same role at Wingate University, which is in just outside of Charlotte in North Carolina, in 2003. 2 years later, I returned to Palm Beach Atlantic University as the dean, served in that position for 5 years, and then I assumed my current role as the director of faculty development for Palm Beach Atlantic University, and also as professor of pharmacy practice in the School of Pharmacy. I still teach a course in clinical pharmacokinetics and take advanced practice experience students in an academic rotation. I also have a elective course, an independent study course on clinical research and publications in which I assist students in obtaining their first publication. These 5 sessions on optimal outcome precepting. The first one, as we mentioned, is going to be on experiential learning in relation to basketball. The second one is on evaluating student performance, on assessment, what I call GPS precepting. The third one is on designing a structured, well-organized training experience. The fourth one on strategies for bringing out the best in every student. And the fifth one on traits of great preceptors and characteristics of great rotations. Now, the information in these 5 sessions is very similar to what was covered in the original session, entitled 6 Steps to Becoming a Super Preceptor. Now, that session provided a broad overview of precepting principles and practices. What we're going to be doing in these 5 sessions is going into much greater detail. But it will help if you've already seen the video on 6 steps to becoming a super preceptor. The first 2 steps is what we'll be talking about today. Designing the features of a prototype student, which focuses on learning outcomes. And that means defining the target, what a student should be expected to achieve as a result of completing the rotation. The second one is to focus all assignments and activities on those learning outcomes. So what we expect students to do is consistent with what we expect them to achieve. Before we begin discussing the aspects of precepting students, I guess it's good to begin with a question of why is this important? What is it about precepting that causes us to put effort in to becoming as good of a preceptor as you possibly can? Have you ever thought about that? Why is it important to set up a good rotation, to be a good preceptor, the best preceptor you can possibly be, to develop your students to be the best pharmacists that they can possibly be? And there's 2 very simple answers to that question. The first one has to do with those who are going to work with the students that you train. Your students will eventually graduate, they'll become pharmacists, and they'll be working alongside other pharmacists. Those pharmacists are going to hope that you do a good job of training your graduates because they're going to have to work with them. In fact, it's possible that you may end up having to work with them someday. Several of the students that I trained, I ended up working with when I was a pharmacy director. Second reason that precepting is a very important responsibility is that patients are going to be counting on the service of the pharmacists who you train. And if you don't train them well, they're not going to be able to provide the best possible service to their patients. They may end up serving patients who are good friends of yours, who are relatives of yours, possibly even you yourself. So for 2 reasons, who they're going to be working with and the patients they're going to be serving make precepting a very high responsibility that needs to be taken very seriously. Bottom line is people are going to be counting on you to do a good job in training the students who go through your rotation.